But Paul Hardy is a board-certified neurologist with a subspecialty training in behavioral neurology, neuropsychiatry. He has held teaching appointments at Harvard Medical School and Tufts University School of Medicine. For the past 30 years, he has specialized in working with developmentally disabled individuals throughout their life cycle, particularly those with autism. Since 1997, he's been a Defeat Autism Now physician, combining his academic background in neurology and psychiatry with the new concepts and treatments developed by Defeat Autism Now. A particular interest for him has been the recognition, evaluation, and treatment of developmentally disabled individuals with occult subclinical seizures. Often these seizures can contribute to cognitive, linguistic, and behavioral disturbances. Please welcome Dr. Hardy.
All right. It's been a long day for all of us, I think, and I saw some mothers heading home talking about getting ready for Halloween, so you're here. And okay, I have a talk today that I first gave about 5 years ago, and in addition to having a special interest in epilepsy, once I got involved with the Defeat Autism Now movement and started learning more about nutrition and basic biochemistry that I had forgotten since medical school or never learned in medical school, I have bridged the gap between what is commonly now referred to as Neutraceutical therapy, as well as a long time of pharmaceutical therapy. And I like to start with a nutraceutical approach before I reach for the prescription pad. And this talk sort of is a background to why I think that's important and some of the limits of regular pharmaceutical therapy. So this is a brief outline. I'm going to give a brief introduction. I'm going to talk about the limitations of pharmaceuticals, the power of nutraceutical therapy, and a functional medicine approach. Functional medicine is a term that refers to integrative medicine, of trying to move across various systems in the body. One of the problems of modern medicine is that we have our gastroenterologists, our immunologists, pediatricians, neurologists, and everybody is just focused on their one field, and they don't try to integrate across the various organ systems. And of course, when dealing with a complex disorder like autism, one needs to move across the various organ systems. I'm going to talk about there's a synergy between nutraceuticals and pharmaceuticals, and then a brief overview of some of the neuropsychopharmacology that has been used in the past and some of the newer trends. Now, this is a fairly small group here, so if anybody has a burning question, just raise your hand at a point where it may be timely, and I will try to address it. Now, the goals are to focus on using nutraceuticals as a foundation for therapy. I will emphasize the limits of pharmaceutical therapy. I'll show that they at times can be superior to pharmaceuticals, nutraceuticals can, and I will try to show how nutraceuticals and pharmaceuticals can be complementary to each other and synergistic. Okay. I will show how pharmaceuticals in many ways are dependent on good nutraceutical therapy foundation. I will introduce the concept of pharmacogenomics and nutrigenomics. Now, these are pretty new and somewhat complicated topics. I'm just going to sort of give you a quick overview. And in the handout, which I believe is on your CD-ROM, I have all of this fairly well defined for your sort of review and digestion later. Finally, I'll review some of the specific treatments of seizures and stereotypic motor activity in autism. My particular interest, in addition to epilepsy, is the relationship between behavioral disorders, psychiatric disorders, and neurologic disorders. Neurologists are often trained just to think about the brain, and if it has anything to do with psychiatry, they want to just clamp down and disregard it. The psychiatrists, on the other hand, if it has anything to do with the brain and being organic, they don't want to deal with it. And so there's often a divide. Okay, here are some of the key concepts. Nutraceutical is any natural plant or animal derivative that has nutritional or therapeutic value for maintaining health or treating disease. And these can be given by mouth, paros, PO, transdermally. They can be inhaled, or they can be given as IVs, intravenous injections, or IM injections. And these are some of the various nutraceuticals categories. Then supplements, I equate essentially to nutraceuticals. And pharmaceuticals is any regulated agent requiring a prescription or over-the-counter therapy which is monitored by the FDA. For example, Prilosec once was just a prescription medication. It's now available over the counter, but it's still very closely monitored by the FDA, and that's in America, in the United States, the Food and Drug Administration. You have no doubt something equivalent to that here in Canada. Okay. Now, there's a very interesting new concept in the United States called medical foods. And right now there are 3 medications that are considered medical foods. And for me, when I first learned about this 2 years ago, I mean, it was a great irony. I laughed all the way home. And the story behind this is that there was a company in Germany, and the Germans are much more interested in nutrition than we are here in the northern North American continent. And these products were developed in Germany. One is called Deplin, the other Serafolin, NAC. NAC stands for N-acetylcysteine, and then Mantex. And these were developed, specifically Serafolin, for the treatment of Alzheimer's disease. And lo and behold, it's a combination of methylfolinic acid, methyl B12 in oral form, and N-acetylcysteine. But the B12 is at a dose approximately what we have been using in the DAN movement for 15 years, but the methylfolinic acid is 10 times what we commonly use in our work in the Defeat Autism Now movement. And I, for years, have recognized that there's a parallel between autism as a chronic developmental disorder and the neurodegenerative disorders like Alzheimer's disease and Lou Gehrig's disease, amyotrophic lateral sclerosis, because the common denominator is oxidative stress, and too much oxidative stress. And Mantex has been specifically developed for treating high homocysteine levels in the blood. Deplin as a potential augmenting agent in the treatment of treatment-resistant depression. So these were very interesting sort of prescription products. They do require prescriptions that have come on the scene in the States. Now, another key concept, nutragenomics. This is the study of how our genome is affected by nutrition. Now, when I was in medical school, we were given very basic training about nutrition, one lecture or one day, and that was it, because in fact modern medicine doesn't think nutrition's all that important. More attention is being paid to it now as a result of understanding how the fats that we take in our diet affect our cholesterol and triglycerides, and then the whole new knowledge about the problem with trans fats. But in general, no one ever thought that nutrition can alter the human genome. It used to be thought that the human genome was fixed and you could not change it. And then pharmacogenomics is the study of how the human genome affects the efficiency and metabolism of drugs, and how new and better drugs can be developed. Now, this is where pharmaceutical companies are putting in hundreds of millions of dollars to do research on how to figure out what genes you can test and how that will predict the prescription of, and looking for side effects of medication. Now, since getting involved with the Defeat Autism Now movement, I have felt as though I'm straddling a fence between traditional neuropsychopharmacology, which had been my bread and butter practice for 15 years, the first 15 years of my professional career, and then the Defeat Autism Now approach that has a much more integrative, basic biochemical and nutritional emphasis. And sometimes straddling that fence is not comfortable. I also feel as though I have a scarlet letter branded on my forehead. And I take a lot of derision in my medical community for being a quack who prescribes supplements and vitamins to individuals with autism. So that's a bit of the background there. Now, the biases that exist in traditional allopathic medicine. I know there was a talk within the last hour, I believe, today on homeopathic medicine. Allopathic is the sort of traditional approach to healthcare that has evolved in the United States and like here at the University of Toronto for 100 years. And this is a book that was written by a Marsha Angel, who was editor of the prestigious New England Journal of Medicine in the States for probably about 8 to 10 years. And she has written this book about the problem with pharmaceutical companies, drug companies. And just a direct quote from this book, drug companies have enormous influence on what doctors are taught, what drugs and about drugs and what they should prescribe. In my more cynical moments, I will argue that some of the most prestigious academic institutions in the country are nothing but whorehouses, with the heads of the departments being pimps and a lot of the doctors being the whores, whoring with pharmaceutical companies. Because in the modern world, you build your career on research and publications, and the main source of money other than the government is the pharmaceutical industry, where you can create patents and make millions, if not billions of dollars. So nutraceuticals, nutraceuticals are, you know, the stepchild. They're the Cinderellas in the field, if you will, because they're not patentable and they're not profitable, and physicians look down their nose at nutraceuticals. And it's, you know, the prescription pad is a power trip for any doctor. And they get upset when patients, families start using nutritional supplements and making decisions on their own outside of their control. And so, you know, medicine in part is, you could say, they've become control freaks. Now, I'm going to come back to develop that point more in a few minutes. And then the biases of traditional allopathic medicine, as I've mentioned, negligible training in medical school, the power trip, trained to regard nutraceuticals and supplements as dangerous. There's a tremendous bias about people taking medicines, nutraceuticals on their own and getting into trouble. So if someone takes a vitamin like vitamin D or vitamin A in particular, and they develop toxicity about it, that will be written up and published in one of the prestigious journals as a letter to the editor or as a small article, but you never hear the medical community publicizing all the side effects that occur, sometimes they do, that occur with all the prescription medications that we prescribe. I mean, the atypical antipsychotics have this tremendous side effect of weight gain, and elevation of blood fats, the lipids, and glucose intolerance. It's a major problem, and the side effects from taking too many vitamins is incidental compared to what goes on with prescription pad medicine. And doctors are fearful of alternative and complementary medicine, and in part it's financial, and I'm going to show you some figures in a minute. Okay, it's come up sooner than I thought. So, unconventional medicine in the United States, and this is a study back in 1998 out of Harvard. And just to focus your attention on the underlining, second line down, the vast majority, 83%, also sought treatment for the same condition from a medical doctor. However, 72% of the respondents who used unconventional therapy did not tell their medical doctor that they had done so. They kept it a secret. And no doubt you, as parents, know you don't tell your pediatrician all that you're doing because they will either get angry or look down their nose at you. And then on the medical side, or the financial side, 425 million visits to unconventional therapy practitioners. This was back in the mid-90s. This was written in 98. And then the expenditure of money out of pocket by families exceeds that for conventional therapy. And this literally scares the SHIT out of the medical community. The resources are going elsewhere. So they view alternative medicine as risky, and they consider it irrational, and if people practice or use supplements or nutraceuticals, they're putting themselves in danger. And you as parents, I'm sure, have sort of felt that way. This was an interesting small computerized disk, CD-ROM, that helps physicians look for drug-drug interactions, particularly with the herbs and the dietary supplements. And a direct quote out of the cover on the back is, "It helps you avoid potentially hazardous drug, herb, and drug supplement complications." And they also use the term vitamania that is going on in our current society. Now, to sort of compare the two, pharmaceuticals are seen as potent, safe, effective, they're MD empowered, drugs can alter the effects of nutrients, and they're new and scientific, whereas nutraceuticals are weak or dangerous. There's, this sort of dichotomy. They're either too weak to do anything or they're very dangerous. There's incongruity there. Ineffective, they empower the patient. Nutrients can alter the effect of drugs, and they're old and mundane. So those are some of the contrasts. Now, if one truly practices Hippocratic medicine, Hippocrates was the Greek who began to found the basis of medical treatment, the philosophy of care, and long before the pharmaceutical industry, he said, let food be your medicine and medicine be your food. So, in a sense, those of us who have been interested in a nutraceutical approach are trying to practice Hippocratic medicine. So I would ask, is nutraceutical medicine really alternative medicine, or has traditional medicine become an alternative to true Hippocratic medicine? Now, the great American, actually, he's, I believe, is Canadian, Sir William Osler. He was at the university, or at McGill University, before he went to Johns Hopkins. He was recruited out of McGill to go to Johns Hopkins in the 20s and 30s. And he, sort of after Hippocrates, is one of the great sort of esteemed not only clinicians but philosophers of medical care. And he wrote back in the early part of the century, one of the first duties of the physician is to educate the masses not to take medicines. And the desire to take medicine is perhaps the greatest feature that distinguishes man from animals. That's Sir William Osler. Now, the limitations of pharmaceuticals. You don't need to get all the details here, just the gestalt of it. This Dr. Alan Roses was one of the most prestigious physicians at the Duke University School of Medicine, geneticist. He jumped over into the pharmaceutical industry, which happens so frequently. And he wrote an article, or gave a talk in London, actually, at a scientific meeting. And as part of that talk, he said, and this had to do with genetic research and pharmaceuticals. Fewer than half of the patients prescribed some of the most expensive drugs actually derive any benefit from them. Less than half. And he ultimately lost his position in the pharmaceutical industry because of this speech. They didn't like it. He goes on, drugs for Alzheimer's disease work in fewer than 1/3 of patients, whereas those for cancer are only effective in about 1/4 of patients. Drugs for migraine, osteoporosis, arthritis work in about half the patients. Most drugs work in fewer than 1 in 2 patients, mainly because the recipients carry genes, and this refers to the genomics now, that interfere in some way with the medicine. And the vast majority of drugs, more than 90%, only work in 30 to 50% of people. So that's the take-home message there. So if you get any grief from your pediatricians in the future, you can tell them that studies have shown that the prescription medications only work in the majority of cases in 1/3 to 1/2. Now, compare that, yes?
Can I ask you a question on that? I read it like 2 weeks ago, so I might be misquoting the article, and I believe it was by Dr. Amy Esco. It was regarding acid reflux, and cellular changes did still occur on PPI therapy with Prevacid, but when given, I believe it was NAEM or NEEM, which would be a natural therapy, cellular changes did not occur and was found to be more effective than a prescription PPI. Are you familiar with that article?
No, I'm not.
Oh, I wish I should have.
Yeah. But that's from Amy Esco.
Yes,
All right, I'll look for that. Thank you.
I got it right on her website.
Okay.
Just Google on all her things now. Do you have an alternative to, what are your thoughts on prescription Prevacid in those?
I don't have an opinion on that. That's outside of my area of expertise. So I don't have an informed opinion on that or recommendation. So this data here, it would be greatly derided in mainstream medicine, because it's collected from parents. But this is the Autism Research Institute data bank on parents reporting what drugs, various drugs, do to their autistic children. This, they fill out a questionnaire, and ARI analyzes it. So this is hard to read, but let me just sort of summarize it in like with amphetamines drugs for ADHD in the context of autism. 47% of the children get worse, 28 have no effect, 25% got better. And there was an odds ratio of 0.5 to 1 of there being a benefit. And contrast that to, say, diflucan or nystatin, the antifungals, 5–6% get worse, 44 to 47 no effect, and then 50 to 47 get better, with a odds ratio of 7, 8, 9 to 1 improvement. So that's just one example of how pharmaceuticals can occur in autism, the benefit ratio. But then contrast that to these various nutritional supplements that they have analyzed. And fatty acids, 3% worse, 46% no effect, and then 50% better. So you get an odds ratio of 15 to 1. The DMG and TMG don't quite have as high an odds ratio. And then food allergy treatment also 15 to 1. So one can argue that a nutraceutical approach in the context of autism is, in the majority of cases, better and more effective than a pharmaceutical approach. But I try to blend the two, quite frankly. And the only sort of disagreement I ever had with Dr. Rimland was that he thought Ritalin was terrible and the stimulants in autism, but I have seen it helpful in a certain subset. Okay, the costs of morbidity and mortality with pharmaceuticals is significant. One published study in 2000, the cost of morbidity and mortality was $177 billion in the United States, with a 132% increase since 1995. So the more sophisticated we get, the more harm we also incidentally seem to be creating. And so as sort of each year goes by, there's a greater cost in terms of morbidity and mortality associated with pharmaceuticals. And in this particular study, they conclude that drug-related morbidity and mortality continue to pose a serious medical and economic problem for society. They urge that more attention be directed toward developing solutions that reduce and prevent morbidity, mortality, and the costs associated with drug-related morbidity, mortality. Nothing about looking at nutraceuticals. And then a few years back, there was this sort of disaster in the pharmaceutical industry in the States with Vioxx and Merck Sharp Dome in St. Louis. This had been a multi-billion-dollar product for them, $2.5 billion in sales in 2003. And it was associated with an increased risk of heart disease, stroke, heart attack, and had to be suddenly withdrawn from the market. And within 1 weekend, the shares plunged 14% and almost bankrupted the company. So big, big business. The limits of pharmaceutical therapy. A couple of quotes here. A Dr. Fisher, half of the modern drugs could well be thrown out of the window except that the birds might eat them. And then from Napoleon, medicine is a collection of uncertain prescriptions the result of which, taken collectively, are more fatal than useful to mankind. Okay, the limits. We've just finished now the power of nutraceutical therapy and a functional medicine approach. Nutraceuticals affect the pharmacodynamics of pharmaceuticals, that is, how the drugs are metabolized. And if men drink grapefruit juice, they can bolster the effect of their Viagra. It lasts longer. And so that's something that is known in certain circles. Nutraceuticals affect the pharmacokinetics of pharmaceuticals. That is how the drugs are metabolized. And some nutrients can speed up metabolism or slow metabolism down. And again, the pharmacokinetics are how the body acts on the drugs. Detoxification is a major part of pharmacokinetics. And in traditional medicine, we pay attention to phase 1 only. This is called the cytochrome P450 system. And if you have certain polymorphisms in this area, you either rapidly metabolize drugs or you don't. So there's this very potential serious adverse interaction between Depakote, valproic acid, and lamotrigine, Lamictal, 2 anti-seizure medications. And if you are not aware that Depakote slows down the metabolism of Lamictal, you can cause the Stevens-Johnson syndrome, which is this scalding reaction, skin reaction, that can lead to death. So you need to be aware of the various aspects of detoxification. And then nutraceuticals can affect gene expression. And one of the most poignant examples of this is in the United States, in the Southwest, the Pima Indians, who were in the desert, dry region. They were fierce warriors. They were able to run long distances without getting tired. They were able to go for days without eating. So guess what happened when they all got rounded up during the Western wars and the containment of the Native American population and put into reservations? 100% of them developed diabetes on the food supplements that were provided by our government. And diabetes is a major problem now in the Native American population. So that's the effect of food on a particular genetic structure. The power of nutraceuticals flow from the fact that all human biochemistry and physiology rests upon good nutrition, including detoxification. If you're deficient in sulfur, you can't detoxify. And many of the children with autism are grossly deficient in in sulfur, and their detoxification is severely impaired, in part because they have received the various toxins, whether it be in the form of mercury or lead, and the body has tried to get rid of this stuff and totally used up the sulfur supply. And all of human evolution and various cultures have been shaped by nutritional factors. And the discipline of molecular nutrition links the pharmaceuticals, the nutraceuticals, with pharmaceuticals. Now, these are just a few of the people that have been prominent in this field over the years. Linus Pauling being one of the first a half century ago. Abraham Hoffer was a biomolecular psychiatrist. Bruce Ames is still alive, and he has worked a great deal on the new genetics and how how nutrients affect gene expression and the rates of metabolism by enzymes. And many of you are familiar with the work of Jill James and the whole glutathione hypothesis and the role of methyl B12 in augmenting glutathione. So these are a couple of definitions of functional medicine and molecular nutrition that are in your handout. I won't belabor that right now. You can read about that later. And in functional medicines, nutrients act as important biological response modifiers at every level of human biochemistry and physiology. And in functional medicine, the health of the molecular milieu of the body depends on the interaction of the individual genes with the macronutrients, micronutrients, and occasionally and conditionally essential nutrients. So functional medicine, this is a definition, and that's in your handout. I won't belabor that for the sake of time. This was an important paper that came out of Mass General a number of years ago, and a prominent cardiologist there, Alexander Leaf, found that you could prevent the sudden death syndrome in adults, where men in their 40s and 50s just keel over and drop dead, by using polyunsaturated omega-3 fatty acids. This was a landmark study, and it came out of the Harvard Medical School. And this is an article on how omega-3s can help alleviate convulsions in patients with epilepsy. All of my patients with epilepsy, well, all of my patients, I like to make sure that they have a supply of omega-3 fatty acids, whether it be in the form of cod liver oil or the other forms that are available. And this was a study in which they were able to determine in the laboratory setting how polyunsaturated fatty acids modified the genes in a particular model's paradigm. These are some of the disorders, medical disorders, that can be affected by polyunsaturated omega-3 fatty acids. And then this is a quote from Dr. Ames. About 50 human genetic diseases due to defective enzymes can be remedied or ameliorated by the administration of high doses of the vitamin component of the corresponding coenzyme, which at least particularly restores the enzymatic activity. So this is derided as vitamin megatherapy by traditional medicine. And God forbid you become a vitamin megatherapist physician. It's about the second or third worst thing that you can be accused of. And then this is, he goes on further talking about all the various polymorphisms. A term that if you're not familiar with it, I'll just throw it out because you need to become familiar with it, is SNPs. SNPs, single nucleotide polymorphisms. And this comes out of our work, or not my work, but in the Human Genome Project. And we not only have 35,000 different genes, but the permutations and combinations of the nucleotides in those genes is infinite. And this is what is responsible for all the variation of the human population and why we are susceptible to the various illnesses and diseases we're susceptible to. I have a problem with kidney stones. My father has a problem with kidney stones. My sister has a problem with kidney stones. I recently learned that a great ancestor died of kidney stones. I almost died of kidney stones. I'm lucky to be here today, if it weren't for modern antibiotic medication. So all of us, whatever our illnesses are, our susceptibilities, it's because of the single nucleotide polymorphisms and the diets that we have. I had to give up all my favorite foods that contain oxalates chocolate, peanuts, all the nuts. I loved hummus. And I switched from, when I first got involved in all of this, from cow milk to soy milk. Well, that was about the worst thing I could have done, because soy is so high in oxalates. So that's just the interaction between our diets, the environment, and our genes. Okay, synergy of nutraceuticals. And very quickly, basic axiom: in order for pharmaceuticals to work optimally, nutraceuticals need to be optimally balanced. And you can pour in all the Prozac in the world. If you are folic acid deficient or tryptophan deficient, the Prozac is not going to work very well. And this is just a list from a course at Harvard Medical School about 5 years ago on natural remedies. Well, actually, it's more than 5. It's now 6. It's coming up on 7. On natural remedies for psychiatric disorders. And this is just a list from that 3-day course that was given at Harvard Medical School as part of the continuing education. So there is an emerging interest in this, but again, it's a stepchild. And then this was for the effect of various nutraceuticals on dementia, alcohol dependence, sexual dysfunction, and weight management. Autism and schizophrenia. Now, 30, 40 years ago, autism was equated to childhood schizophrenia. They were felt to be one and the same. And then haloperidol came along, and it was one of the few treatments that was used with childhood autism. Then there's been a separation from the two, but in some ways we're going to come back and see a slight, as we understand the biochemistry and the nutritional aspects of brain function, see that there may be a convergence after this divergence. And this is getting a bit technical in terms of the positive and negative symptoms of schizophrenia, but the negative symptoms of schizophrenia very closely match up with the key features of autism. Now, that's just a preface to show you this diagram from a recent textbook of psychopharmacology. It's from the textbook that I showed, Straddling the Fence. And lo and behold, right here are these glial cells. Now, when I went to medical school, we were taught glia, which means glue, was just what held the neurons together. It turns out they're very important for nutrition, supplying nutrition to neurons. And they're also very important for regulating neuronal function. And one of the main neurotransmitters is glycine. And glycine is the major inhibitory neurotransmitter in the brain, along with GABA. So gradually, as more and more research is being done in traditional psychopharmacology, we're realizing that basic amino acids are extremely important. This was a study on the role of glycine in augmenting traditional, conventional antipsychotics, and it was found to be of benefit in some individuals. And this was another study showing the same thing. This is a very young field of looking at how nutrients can influence particularly psychiatric and psychopharmacologic treatment. Now, in the few minutes that are left, just I'll give you a quick overview of traditional neuropsychopharmacology in autism. It's a particular interest of mine. I'm just going to race through it. If there's something there that catches your eye, or if you have a question about how medications have been used or recommended for your child, I'll be happy to answer them in the question time and leave time for that. Okay. There are no specific approved medications to treat, prescription medications to treat autism. In the States, and I assume similarly here in Canada, risperidone, has been approved for use in treating the behavioral disturbances associated with autism. So that's an important distinction. But the side effects associated with risperidone can be significant. Medications in autism are a source of great controversy. I like to use a computer metaphor. The brain is a piece of hardware. And the software of the brain is our learning experience, our life experiences. When my wife, who is a former ICU nurse and now a psychotherapist and licensed and marriage family psychotherapist, and we have, some interesting discussions at times. I work on the hardware of the brain. She works on the software of the mind. And if you, even in a developmentally disabled adolescent, if they're capable, doing therapy can be extremely important. You cannot do good psychopharmacology without working on the software of the mind in terms of the therapy. Now, it may be behavioral therapy, it could be EMDR, but the two have to go together, and that's what you have to do if you're going to have a computer that works efficiently. You always have to start low and go slow. Oops. It can profoundly improve educational outcome, in my opinion, and it can improve development and self-esteem. I have recently, and I think this is true, but it's a clinical observation, and it's, one person in particular, that aripiprazole, Abilify, in a moderately high-functioning Asperger man over the course of 2 years in the setting of a very good school with good educational and psychotherapeutic supports, developed empathy. He was able to go over to a student who was being taunted on the basketball court by another student and offer his protection and sympathy. And this was, in my mind, a remarkable development in this young man, because prior to this, he was obsessed with video games, and his whole world revolved around video games. He had interest in nothing else. That was Abilify, one of the newer atypical antipsychotics. It's Abilify. It's a very catchy, marketing term. That comes from magnifiability. And it's the generic name of the drug is aripiprazole. It's one of the newer atypical antipsychotic major tranquilizers. But in very low doses, it has antidepressant properties, and where I have found it to be most helpful for is obsessionalism and OCD. Okay, so these are some of the traditional pharmaceuticals. There's a whole array of them. Because of my cross-training in neurology and psychiatry, I have been able to go back and forth between them. Many of the antidepressants have psychotropic properties, mood-elevating properties, anti-manic properties. A medication, anticonvulsant like Neurontin, gabapentin, has anti-anxiety properties. So if I have someone who's got epilepsy and a lot of anxiety, I'm likely to introduce Neurontin or try it at some point. The same for sleep disturbance. It's also good if taken at bedtime for sleep. So this is, all very sort of technical stuff, but I just want to give you a brief overview of it. And coming towards a conclusion now, pharmaceuticals depend on the proper nutrition for optimal action. Pharmaceuticals depend on proper nutrition for detoxification. That is the inactivation and removal, especially with sulfur. And both act in a common molecular and physiologic environment. It's a complex web. They can be synergistic and complementary. At times, nutraceuticals can be even superior to pharmaceuticals. And nutraceuticals are to be preferred whenever possible over pharmaceuticals because there are going to be fewer side effects. One of the more interesting things is the one condition that constantly torments me in my 30 years of doing this work is obsessive-compulsive behavior. It's the most, at times, challenging and disabling because it can land the child into interactions with the courts and the law and so forth, and sometimes older adolescent males begin to develop these fetishes that get them into all sorts of problems. And so trying to treat OCD is a major problem. And there's new work coming out that N-acetylcysteine, an amino acid that is used as the main antidote for Tylenol overdose, has anti-OCD properties. I'm just feeling my way along with this right now, but there have been a few case studies, one out of Yale to support that.
Was it transdermal or oral?
It was oral, high-dose oral. You have to get to fairly high doses. But I just, I was part of the seizure think tank discussion today, and I mentioned this, and Martha Herbert, you probably heard Martha Herbert this morning. She pulls out of her purse this little Alka-Seltzer-like tablet, in a foil packet. And she says, this is N-acetylcysteine in a foil packet. And you can order it from a certain warehouse nutraceutical company. And it's very high dose, and she says it's terrific for clearing up mental fog and allergies.
When you say high dose, how many milligrams?
I'm talking about 1,200 to 1,800, 2,400 milligrams. The more we learn about genomics, the fundamental importance and power of nutraceuticals will become ever more apparent, and we shall return to a true Hippocratic and Oeslerian medicine. Finally, treatment needs to be iterative, trial and error. One needs to be willing to stick one's neck out. The doctor does, and not many doctors are willing to do that. And it's going to, in the United States, become more and more difficult with the managed care or the health system that's going to come into place. And I heard someone from England talk about this, and it's probably true here in Canada. But medicine is going to become an algorithm, a cookbook. And if you deviate from that, you're going to get your hand slapped, you're going to get penalized financially, and doctors are going to become robots. And I'm glad I'm at this point in my career when I will be exiting medicine at some point. Now, my father's 92, and 90 this year, and he only stopped preaching. He's a Baptist minister. Only stopped preaching this last year, so maybe I've got some years left. Thank you very much. Any questions? Yes. Well, unfortunately, sometimes Risperdal is the only thing that can help a child, particularly if they are running into the street, without concern for cars, or they're up all night, and they're, one mother was saying how there are holes in the walls, the shades have been pulled down. Sometimes Risperdal is the only thing that can begin to prevent that and give you time to try to then work on the nutraceutical approach. So I will reach for a prescription pad early on if someone's life or real safety is in danger. Well, all of the things in the Dan approach are, key. Making sure that the folic acid is appropriate, and glutathione, all of that. It's a complex web, and there's no one, magic bullet.
What about the pigs?
Ver-
The reason why I say that is because my daughter was very old for about three months, and I saw facial tic develop, and I got scared, and I just...
Well, one needs to distinguish between tics, which can be genetically based and environmentally based in terms of food sensitivities. Anxiety brings tics out. The other big thing is panda syndrome, strep infections, which can bring tics up. And the only treatment for that is an antibiotic. Risperdal isn't good for the particular tics with pandas. You have to distinguish between tics and then the side effects of dyskinesia that you can get from medications like Risperdal, usually over longer periods of time, years. But some children, because of their particular single nucleotide polymorphism pattern, they can get drooling and dyskinesias orally very quickly. And I've had one such girl, a young lady actually, she's in her 30s now with terrible OCD. I tried her on various Abilify. Abilify is low in terms of causing dyskinesia, but she developed it early on. And so again, everything has to be trial and error and individualized.
Once you get it, does it usually stay?
No. If you're 60 years old and you've been taking the drug for 40 years, it may be permanent. And I don't know where you would go in Toronto to see people with chronic mental illness and alcoholism out on the street. But if you pass these people, they're usually got all these facial distortions, and that's tardive dyskinesia. It's permanent. But in a young person, it's likely to be very transitory.
Would you recommend a Moses chart for a database or a baseline to check that?
Yeah, there are various movement disorder scales, that you can use and sort of monitor individuals. Yeah. But the other interesting thing, and I can't bring everything up, but it's just jumped into my mind, so I'll blurt it out. The other interesting neurotransmitter that we will need to be paying more, or we'll be paying more attention to, is glutamate. Glutamate is the most prevalent and predominant excitatory neurotransmitter. It's abnormal in epilepsy. And glutamate burns cells up if it's excessive. This is what happens in Alzheimer's disease and some of the other neurodegenerative disorders. I am beginning to suspect it's playing a role in tics. And I have started using N-acetylcysteine in a couple of my severe Tourette patients. And then this other interesting medication, memantine, which is used to treat Alzheimer's disease because it's an anti-glutamate agent. But it's too... You have me back in a year or two, and I'll maybe be able to tell you more about that.
Do you think even at low doses, like my son was just prescribed transdermal NAC, but I think it's 200 milligrams per ml, meaning 0.5 cc, usually 100 milligrams, 200 milligrams total. Do you think that might have any effect?
It might, but I think, you're probably going to have to go higher.
Off the top, maybe don't increase the strength after 20 milligrams.
Yeah. All right. I guess you can go trick or treat.